Hello, veterinary professionals. My name is Casey Bishop here in the VetSpecs demonstration room with our brand new VetSpecs WM100 and WM10 veterinary specific wireless vital signs monitoring systems. We're going to begin our training on these two new products, and we're going to start off with everything related to the ECG components. We are also going to be incorporating our unofficial mascot demo as part of the training. Continuing on with our ECG training on the brand new WM100 and WM10 wireless vital signs monitors, we have in front of us the two platforms, of course, the wireless multi-parameter main module, the ECG temperature extension cable, the two different sizes of ECG temperature esophageal probes, the 2-lead ECG and rectal temperature set, and last but not least, the 3-lead ECG set. Before we get started in on the actual external components for the ECG, I did want to bring your attention to the two different display modes that you're seeing here. It's important to note that both the WM100 and WM10 platforms can either show the ECG only mode or the multi-parameter or all-parameter mode. It does depend upon what you have connected to the patient. So for instance, if you have only ECG lead wires attached to the patient's body, the monitor will go right into ECG only mode. If you have ECG lead wires or esophageal probes, plus any other function such as temperature, SpO2, CO2, the monitor will automatically go into multi-parameter or all-parameter mode. As far as moving forward, for multi-parameter mode, we are focusing on this very top line, the first channel, with the green ECG waveform, the ECG heart rate, as well we'll be talking about temperature. To utilize the ECG component on either the WM100 or WM10 system, you first want to, of course, turn on the monitor platform itself, then obtain your multi-parameter wireless module, of course, turn it on. If you have not watched our video on the charging and powering aspect of the wireless main module and blood pressure module, please do watch that video. It's very important. Now that we have the wireless main module on, you can either choose to go leads directly into the esophageal, the ECG temperature port. You can use esophageal probes or either of the two lead wire ECG sets. You can plug directly into the port with those items, or you can use the ECG temp extension cable. I'm going to go ahead and grab that item. The ECG temperature extension cable is definitely optional. You do not have to use it. It certainly does help if you are needing extra length from the connection to the patient from the away from the module itself. To use the ECG temperature extension, just simply take the extension, plug in the extension cable directly into the ECG temperature port, and then you are good to go. We are now going to focus our attention on utilization of the esophageal ECG temperature probes. Here we have the esophageal ECG temperature probes, which come standard with any of the multi-parameter VetSpecs monitoring systems. There are two different sizes. We have what we refer to as the cat esophageal probe or the dog esophageal probe. To be more specific, the cat probe, our standard small probe, it is geared, if you will, for patients between 5 to about 30 pounds. The larger dog probe is going to be from 30 pounds on up. We've even seen this probe in use on patients well over 180 pounds. It is important to note we do carry an extra small esophageal probe that is going to be applicable to patients from about half a pound up to 5 pounds. To utilize an esophageal ECG temperature probe, go ahead and, of course, choose the probe based upon the size of the probe, based upon the weight of the patient. Simply plug the probe in, again, either into the port directly into the module or into the end of the extension cable, just like so. What you then want to do is take a look at the patient, go ahead and determine about where the heart of the patient is, take the esophageal probe, lay the center contact on the outside of the patient's body, run the PVC material loosely along the esophageal line, just again on the outside of the patient's body. You're going to notice that there is a spring-loaded clip that will help you pre-measure your depth. And so here we have it, again, out to the end of the mouth, center contact in line with the patient's heart, out to the end of the mouth. Go ahead and mark your spot with your spring-loaded clip. This will be your reference so that if the probe happens to pull out or go a little bit further in, all you do is pull that probe out to that marked location. This allows you to have, once the clip is in place, this allows you to open the patient's mouth. Of course, the intubation tube is already intubated into the trachea. The esophageal probe, of course, is going into the esophagus. So just simply open up the mouth, insert the probe until you come to your marked location. And at that point, you're going to get beautiful ECGs as well. There is a temperature sensor built into the tip end of the probe. That is going to give you core body temperature. If you start to lose ECG signal at any time during the procedure, just simply pull the probe in and out of the esophagus, just back and forth about a quarter inch or so. What that does is it relubricates the contact points by the natural moisture in the esophagus, and relubricating those contact points will advance or increase the quality of the conduction, and that will give you much better ECGs as well. Of course, if the probe were to pull out or go further in during a procedure, just again use your pre-measured marked location as your guide, and you'll be good to go. While we're here, I wanted to go ahead and touch base on cleaning the esophageal ECG temperature probe. So at the end of any given procedure, just simply remove the probe from the esophagus. Go ahead and take yourself a 2x2 or a 4x4 with some dilute chlorhexaderm, Novosan, trifectant. Any of those cleaning agents will be just fine. A lot of practices will even have a canister prepared and ready with those with that gauze for cleaning. Take your gauze, just grab the probe, wipe the probe off, and that will keep the probe in nice good shape. You of course can use that same gauze with the cleaning agent to wipe off the wiring on your pulse ox sensors, any of the cabling and so forth. It's perfectly fine to use that cleaning agent to clean off those areas as well. To apply the 2-lead ECG and rectal temperature probe set to the patient, simply take your 2 lead wires and apply one to the right front leg and one to the left rear, and of course the rectal probe to the rear of the patient. To physically attach the ECG limb plate to the body, you certainly can go through the buckle. That will allow you to get more of a cinched connection to the patient. Again, just put that right through the buckle, such as so, and then pull the Velcro back towards you. That will allow it to stay on better. Or you can simply just apply the metal contact right against the patient's skin. There is no need, against the fur really, there is no need to clip the fur. Just again, apply it right to the limb, take the strap, wrap it around, again ensuring that the metal contact plate is right against the fur. Soak down the contact plate with a conduction agent such as saline or alcohol. Conduction gel would be fine. Some of our customers will even take a 2x2 or a cotton ball and place it between the metal plate and the fur, and that will allow you to have a much longer period of conduction. We now have demo physically hooked up with our 2-lead ECG and rectal temperature set. As you can see, one to the right front, one to the left rear, metal contact plate against the fur, soaked down with saline, alcohol, or conduction gel, and of course rectal temperature probe to the rear of the patient, and that will give you wonderful ECG clean tracings with the very valuable temperature, again, for recovery, ICU, and dentistry. One note as well, Typically, the location will be somewhere between the paw and the elbow on the front leg, and on the rear leg, somewhere between the paw and the hock, just for location. This is our 3-lead ECG lead wire set with limb plates. To apply, just simply attach the limb plates, one to the right front. Actually, more specifically, the white will be to the right front, red will be to the left rear, and black will be to the right rear. That will give you a true lead-to diagnostic quality ECG tracing. The 3-lead wire set is typically utilized when you're doing a workup or a screening. It is also important to note that we do have the option with our snap leads to disconnect the limb plates and go with a paddle clip or flat clip, if you will, for customers to prefer that over the limb plate design. Here we have each of the 3 limb plates attached to Demo's legs. Again, one to the right front, one to the left rear, one to the right rear. The reason I have no lead wires attached is this allows us to go ahead and hook the limb plates up, apply the alcohol. This is wonderful if we need to transport Demo from one location to another. This also works with our 2-lead and rectal temperature set. At this point, we just simply take our lead wires, again, red to the right front. I'm sorry, white to the right front. Let me get this straight. So white to the right front, red to the left rear, and then black to the right rear. And we will now get a beautiful ECG. Again, remember to apply liberal conduction to the limb plates. That is necessary to get that ECG.